Welcome to our tutorial on mastering multiple-choice medical coding questions using the elimination technique. In this video, we'll explore how to effectively approach these questions to increase your chances of selecting the correct answer. Let's dive into a scenario where a patient presents with seizures and undergoes a brain MRI examination. We're tasked with determining the appropriate procedure and diagnosis codes for this encounter. Here is the question. A patient experiencing seizures was received in a facility where a brain MRI both with and without contrast material was performed. The MRI impression reveals normally symmetric medial temporal lobes and the examination results fall within normal parameters. What procedure and diagnosis codes should the provider document for this case? Here are the choices. Letter A, 70552-26 and Z13.858. Letter B, 70559-26 and R56.9. Letter C, 70551-26, 70552-26 and R56.9. Letter D, 70553-26 and R56.9. You can pause the video at this point to give yourself some time to solve this question. Once you have an answer, hit that play button to find out if you got the correct choice and if your reason and method for choosing aligns with the elimination technique. Ready? Let's examine each of the choices. Letter answers A, C, and D all report magnetic resonance imaging of the brain, including brainstem. For the most part, the same can also be said for letter answer B, which reports 70559-26 as the procedure code. Code 70559 is grouped with codes 70557 and 70558. While these codes also report magnetic resonance imaging of the brain, these MRIs are performed during an open intracranial procedure. However, if you review the question, there is nothing indicating that the MRI was done intraoperatively. For this reason, letter B is eliminated. The remaining codes 70551, 70552, and 70,553 all belong to the same family of codes and differ from each other with regard to the use or non-use of contrast material during the MRI. Since it is documented that the brain MRI was performed with and without contrast material, answer letter A is eliminated. Code 70552 is brain MRI performed with contrast material. Answer letter C presents us a choice which does appear to satisfy what is documented in the scenario. 70551 is brain MRI without contrast material while 70552 is brain MRI with contrast material. In coding, however, we are cautioned against unbundling of codes, wherein the components of a complex procedure are reported as their own separate codes. This is exactly what answer letter C presents. The fact of the matter, though, is that there is an available code that combines these two steps onto one code. This is code 70553, which reports MRI of the brain without contrast material, followed by contrast material and further sequences. This combination code is to be reported over that of the two-code representation, which is letter answer C. Thus, this option is eliminated. Therefore, our most appropriate answer appears to be choice D, 70553 and R56.9. This choice includes a specific CPT code for the MRI of the brain performed and an ICD-10 code for unspecified convulsions or seizures, which aligns with the patient's presentation. By systematically evaluating each answer choice and eliminating those that do not align with the clinical scenario, we can increase our likelihood of selecting the correct codes in multiple-choice medical coding questions. We hope you were able to learn from this technique shared with you today. With much practice, this should become part of your strategy and bring you great results. Good luck on your upcoming medical coding exam.